The 2023 Annual Report on Hip Fracture Care in our hospitals is now available from the Australian and New Zealand Hip Fracture Registry, the Registry. The Registry's purpose is to improve the care for people who break their hip, and their annual report gives us a view of how hospitals are doing in aligning with the Hip Fracture Clinical Care Standard. The standard is a set of national recommendations for the care that should be given to an older person who presents with a broken hip. The standard is broken up into 7 key quality statements. 1. Care at presentation. 2. Pain management. 3. Orthogeriatric model of care. 4. Timing of surgery. 5. Mobilisation and weight bearing. 6. Minimising risk of another fracture. 7. Transition from hospital. This year, the Registry collected data about the care of more than 16,000 older people who broke their hip. So how did our hospitals do in 2022? For 1, care at presentation. It's important to assess a person's brain health on arrival. 72% of patients had their thinking and memory checked before surgery. This is an improvement compared to last year. 2, pain management. It's critical that patients have their pain assessed as soon as possible. 65% of patients were asked about their pain within 30 minutes of arrival. 3. The orthogeriatric model of care. We know that when a geriatrician and orthopaedic surgeon work together, and with a larger multidisciplinary team, the care and outcomes after a hip fracture are better. In 2022, 86% of patients were cared for by both a geriatrician and surgeon. 4. Timing of surgery has a huge impact on a person's recovery. 78% of patients had surgery within 48 hours. This is not as good as in previous years. 5. Mobilisation and weight bearing. Getting up and moving is key to preventing problems like pneumonia, bed sores, and leg clots. 91% of patients were offered the opportunity to walk on the day or day after surgery. However, only 45% of patients were able to take a step or walk on the day after surgery. There is room to improve on this. 6. Minimising the risk of another fracture. Once you have one broken bone, you are at a higher risk of another. It is key that people are offered treatment for weak bones. This year, 32% of patients were given medicine to strengthen their bones before leaving hospital. Although an improvement, there is potential for more. 7. Transition from hospital. Of the people followed up 120 days after they broke their hip, 79% had returned to their own home. This is just a taste of what is available to you in the full report on the ANZHFR website. Go to this address to download your copy now and understand the full story of how we did caring for people after hip fracture in 2022. That address is anzhfr.org/registry-reports.